everybody, Dustin again. I'm going to bring you a video today about stretching your low back, your glutes, your hamstrings. This is great for folks who have had a back injury and have may become much more sedentary and not moving, or for those folks who have had a spine surgery and are looking to get some range of motion back in their low back, in their hips, in their glutes. A lot of times after an injury, people will not move around due to their pain and they become stiff, or post-operatively they build up a lot of scar tissue, which makes it hard to move, not only from the pain, but also the scar tissue is not very pliable, it's not very mobile, so it makes them more stiff. So these simple exercises and stretches should be able to help you become a bit more flexible and hopefully improve your range of motion and some of the pain that may be associated with the stiffness and tightness of the muscles. So first stretch is going to be for your low back. I'm sitting on a nice stable chair. You can see I have my legs out in front of me. My feet are slightly in front of my knees. I have my hands on my knees as well, and I try and keep my back straight, and I just simply lean forward. I put my hands on my shins because that helps to stabilize my spine, takes a little bit of pressure off my low back, and also by feeling where I am on my legs, I can remember better how far I've gone forward. So over time, I can progress. As you get better, if you can get to the floor, then that's very good. If you can only get to mid-shin and you started out up here, then that's also good. The more you do it, the better your range of motion will become. And you should feel this pulling and stretching down here in your low back, the paraspinal musculature. So just, you move forward, you'll want to hold it. So keep your hands on your shins and hold it 10 to 15 seconds. The more you hold it, the more you get out of the stretch. You can do this a couple times a day, or once a day, once every other day. The next stretch is going to be for our hamstrings and our calves. You simply stretch your left leg out, you keep your other leg bent. Again, you rest your hand on your knee to help support your low back, and you bend forward. And you should be feeling this in your posterior thigh and into your calf. To intensify it somewhat, you can flex your toe. You can try and grab your toe. You'll really feel this in the calf. And again, the longer you hold this, the better effectiveness you'll get out of the stretch. Remember, you want to do both sides. You have two legs, so you want to do both legs. Extend the toe for more intensity and to get into the calf. The next stretch will be to help with mobility of the hip and also somewhat of the low back. You just grab your knee and you pull your leg up toward your chest. You try and bring your knee into your chest as best you can. Some folks will be very immobile and they may not be able to grab their leg. So if you have a towel, you can take the towel, wrap it around your leg, and you can use that to help bring your leg up. If you can only bring it up to here, with time, hopefully you can bring it in further. So you'll want to do that with both legs. Bring this leg in and let it down. This is more of a dynamic stretch. You can go up and down, 10 or 15 repetitions on each one. You can also hold that and really accentuate the stretch by trying to pull it in as far as possible on each leg. The next one we're going to do is to bring our leg up onto our knee. As if you're crossing your legs, you put a little stress on the outside of your knee, and then you just simply lean forward. This does not take much movement to get a good stretch out of it. You're going to feel this in the outside of your hip and in your glute on the side of the leg that you're doing. As you become more flexible, you'll just lean a little bit more forward. Bring the left leg up, add a little stress to the knee, and then simply lean forward. You should feel this along your IT band, your glute med, and into your buttocks here. This is a great stretch. So those are the simple ones sitting in a chair that you should work on. The next ones we're going to do are going to be on the floor, similar to the ones we just did in the chair. The first one is going to be a yoga move. It's called child's pose. This is very simple. If your knees can handle it, if you're able to crouch down or squat down, you sit on your heels. And you simply put your arms out in front of you and try and put your forehead on the mat or on the ground with your arms outstretched in front of you. You can see we're getting a good stretch here along the low back. We're actually also stretching our arms and shoulders. If you have one side that may be more tight than the other, you're just going to work your way to the opposite side. So if your left side is very tight, you move yourself to the right a little bit, and you'll feel this more along your thoracic spine, up into your shoulder blades and in your low back. And you can go to the other side for the right side of the low back. This is something you could hold for 30 seconds, for a minute, however long you feel comfortable. This stretch is similar to the one we did sitting in the chair, where you bring your leg up onto your knee. You can see I'm leaning back slightly, using my arms for support, and I just simply slide my heel back. The more flexible you become, the farther back you should be able to bring your heel. I'm getting a great stretch with this in my hip, my buttock, my IT band. If you feel like you are flexible enough, you can always drop the leg over and put your arm to the outside of your leg and get a little bit of a stretch in your low back. And then we do the other side. Remember, you always have to do both sides. Again, you slide your heel back as far as you can. If you can only go a little bit, then you'll just work on trying to bring that leg back further over time. You hold it, and you can drop to this side and hold, and bring your arm up and over. If sitting in the chair is not quite enough and you're more flexible, you can sit on the floor, try and keep your back straight, and reach forward and try and touch your toes. The more you do this, the easier it will become. The more loose you are in your hamstrings and your buttocks, the more loose you'll be in your low back. If your hamstrings, your calves, your buttocks are tight, your back's going to be tight. That can lead to pain. So there you have it, some simple stretching exercises for people with low back pain, or even if they're post-operative, something simple to start doing to improve mobility. If you like this video, please give it a thumbs up and subscribe to the channel. If you would like more information about spine conditions, or if you have back pain and would like to seek treatment for that, there'll be a link for Revive Spine Center in the description below.